Okay, so if you or a man you love has just heard those four words, you have prostate cancer, I know exactly what you're feeling. The next decision you make could literally impact your quality of life for years to come. One of the most common treatments is surgery, right? But today, that comes with a high-tech choice. Do you go with traditional open surgery, or do you go with the robot? By the end of this explainer, you are going to know the real short-term benefits of robotic surgery. You will understand the long-term realities for your quality of life, and most importantly, we are going to reveal the single most critical factor you need to think about when making this choice. All right, let's dive in. To help us understand all this, we're going to follow the story of a guy named Paul. He was just a 42-year-old delivery driver when he started having some uncomfortable urinary symptoms. At first, he just blamed it on long hours on the road, but it turned out to be something way more serious. His story really shines a light on the critical choices that come after a diagnosis, starting with the one that saved his life, just deciding to see a doctor in the first place. There's no getting around it. Hearing the word cancer is absolutely terrifying. Your whole world just gets turned upside down, and all of a sudden you're hit with this flood of information and a bunch of really complex, life-altering decisions about your treatment. The path forward isn't always clear, and believe me, the stakes could not be higher. So, to help navigate those tough decisions, let's start at the very beginning. We're talking about the diagnosis and the main surgical options that are on the table for men whose cancer hasn't spread outside the prostate gland just yet. For a lot of guys, the recommended plan is what's called a radical prostatectomy. Now, this is a major operation. The whole goal is to remove the entire prostate gland and sometimes some of the tissue around it to get rid of the cancer completely. For decades, this has been the go-to treatment for prostate cancer. Now, what's really fascinating is just how different these two approaches look. With the traditional open method, surgeons make one big 8 to 10-inch cut to get to the prostate. But the robotic method? Totally different. It's what they call minimally invasive. The surgeons work through several tiny little keyhole incisions, and this difference right here is really at the heart of the whole debate. So, keeping that visual difference in mind, let's do a direct comparison. We're going to break down exactly what makes the robotic approach so different and, honestly, why it's become so incredibly popular in medicine today. And when I say popular, I mean it. This number is just staggering. Something like 85%, at least, of all radical prostatectomies in the United States are now done using a robotic system. It's pretty much taken over, which makes understanding its pros and cons more important than ever. So what's actually going on in the operating room with this robot? Let's kind of go under the hood for a second and look at the tech that makes it all happen. The Vinci surgical system. Look, no matter which method a surgeon uses, they've got three main goals. First and foremost, get all the cancer out. Second, try to preserve the parts that control urination. And third, protect the really delicate nerves that are responsible for sexual function. Now, the big promise of robotic surgery is that it can do all three of those things while adding a fourth, really important goal, a faster, less painful recovery. So here's how it works. The surgeon is 100% in control, but they're not standing right over the patient. Instead, they're sitting at a console, usually in the same room, looking at this incredibly magnified, high-def, 3D image of the area they're operating on. From there, they control these tiny little instruments attached to robotic arms. And this is the key advantage. The robot's wrists can bend and rotate in ways a human hand just can't, which allows for these unbelievably precise and steady movements. And that precision, it has a direct impact on what happens right after the operation. So now let's shift gears and talk about the immediate aftermath. Let's compare the recovery experience in that really crucial first month. Okay, let's dig into this data. It comes from a big study out of some Harvard-affiliated hospitals, and you can see the short-term advantages for the robotic approach are pretty clear. On average, patients went home sooner. They reported lower pain scores, and maybe most importantly, they had fewer complications, things like dangerous blood clots or bladder neck scarring, which can make it hard to urinate later on. So, for a typical guy having robotic surgery, the immediate recovery usually looks something like this. You'll probably spend just 1 or 2 nights in the hospital. You'll go home with a urinary catheter, which is just a thin tube that drains urine from your bladder while everything heals up, and that usually stays in for about 1 to 2 weeks. But what about life after that first month? This is where we get into the questions that, frankly, men and their partners worry about the most, the long-term side effects that can really deeply impact your daily life. The first huge concern for almost every single patient is urinary control.
I mean, the ability to hold your urine without leaking, it's something we all take for granted. And the fear of losing that is just, it's profound.
The good news is that for most guys, urinary control gets a lot better over time. It can be a slow process, sometimes taking several months, but surgeons have also come up with these advanced techniques, like something called bladder neck sparing, where they're able to save one of the little valves that helps keep you continent. And in the hands of a really skilled surgeon, that can mean you get your control back very, very quickly. And then, of course, there's the other major concern, erectile dysfunction. This surgery happens in a really delicate spot, right next to the nerves that control erections. So, what's the impact on a man's ability to be intimate? Well, the absolute key here is whether the surgeon can perform what's called a nerve-sparing procedure. The goal is to basically peel the prostate away from those nerves without damaging them. But even then, recovering sexual function is not an overnight thing. It can take a year, sometimes even longer. And as Paul, the guy we met at the beginning, shared, this can be a huge mental and physical challenge, even when the surgery is a total success from a cancer control point of view.
Okay, now this brings us to what might be the most surprising finding from that huge Harvard study. Despite all those short-term benefits of the robot, less pain, shorter hospital stays, fewer complications, when the researchers looked at the big quality of life outcomes 2 years after surgery, the differences basically disappeared. When it came to cancer control, urinary function, and sexual function, the results were, on average, the same for both open and robotic surgery.
So where does that leave us? You've got clear short-term wins for the robot, but pretty similar long-term outcomes. So how on earth do you make a decision? Let's put all this information together and get to the verdict.
This is it. This is the central question we wanted to answer. Is the fancy, high-tech, minimally invasive approach really the better option?
And this right here is the answer, according to the experts. Dr. Mark Garnick from Harvard Medical School just sums it up perfectly. It's not about the robot versus the scalpel. It's about the person controlling the tool. The most crucial factor is the experience and skill of your surgeon with whichever method they've mastered. A high-volume surgeon who's an expert in open surgery might get you better results than a less experienced surgeon using a robot. And the other way around is true too.
So the ultimate takeaway is this. You are not just choosing a technology. You are choosing a surgeon. You have to be an active part of your own care team. Don't ever be afraid to ask these direct questions. How many of these have you done? What are your personal results for cancer control, for preserving continence, for successful nerve sparing? Understanding their track record is the most powerful tool you have to make sure you get the best possible outcome on your own health journey.